Welcome to the Level 4 video, Underweight Issues, in the Complex Infant Problems video series. This video will discuss some of the less common causes of babies who are underweight and strategies that the DBE can suggest to help the mothers continue breastfeeding. Underweight babies can show signs at various times. Some babies get off to a slow start with weight gain from the very beginning. They might lose more than the recommended weight loss in the hospital, or do not regain their birth weight by 2 weeks of age. Some infants, however, might lose weight more suddenly. The most common sign, of course, is measurable weight loss patterns. However, underweight babies can exhibit other signs. For example, they might have fewer than the recommended number of wet and dirty diapers. They might have scant bowel movements. They might still be excreting meconium stools several days after the birth. The diaper in this photo is from a baby who is 4 days old. This was the baby's only stool on that day. What are some things you can see that might be concerning? For one thing, a single small stool at day 4 is a sign of inadequate intake. The stool is also meconium. This means it has not started transitioning. Again, this is a clear sign of insufficient milk intake. Other signs to look for are babies who are excessively sleepy and unable to wake on their own for feedings. Babies might have a very weak cry. They might hang out at the breast for very long periods with non-nutritive sucking. They might have a weak or a disorganized suck. This is because they do not have the calories that they need to boost energy to suck properly. In addition to the more common causes of underweight in babies, deeper problems can sometimes develop. For instance, the baby might have an oral anomaly, such as tongue tie pictured in the baby on the left. Other anomalies might be cleft palate, a large tongue, or lack of development in the baby's buccal pads in the cheeks. Babies with neurological problems can cause poor latch and milk transfer. An example is a baby with hypotonia, or low tone, and hypertonia, which is a rigid tone. Congenital heart problems can cause a baby to tire easily, resulting in a weak suck and milk transfer. Babies with reflux or GERD and babies with both more common and chronic illnesses may not gain sufficient weight. Babies who are experiencing lactose overload might have trouble gaining weight as well. In addition, there can sometimes be maternal factors to consider. You can see the image on the right as an example of a breast anomaly. Hypoplasia, which is that large spacing between the breasts, underdeveloped breasts, breasts that are dramatically different in size, and tubular breasts can all indicate insufficient glandular tissue. Mothers who had prior breast surgery or chronic medical conditions can have a limited ability to produce a full production. This, of course, can lead to slow or faltered weight in the baby. As part of the assessment, the DBE can learn more about the mother's breastfeeding history to identify practices that might have contributed to the baby's poor weight. A breast assessment can reveal any breast anomalies or surgeries that might affect production. The DBE can observe a feeding session to rule out poor positioning and latch issues. This can also help you learn more about the mother's feeding practices, such as the frequency, using breast compressions, offering both breasts, and allowing the baby to drain the breast. Observe the infant for any illnesses or conditions that might make it hard for the baby to transfer milk. Ask open questions to help you learn about potential causes. For example, tell me more about how breastfeeding has been going. How do you feel about your baby's weight? What has the baby's healthcare provider said about the baby's condition, illness, or about the baby's weight? How does your baby act before, during, and after the feedings? How do your breasts feel before and after feedings? In addition to basic solutions, it might be necessary to supplement the baby, preferably with the mother's express breast milk. Expressing milk by hand or with a breast pump after feedings can stimulate production and generate extra milk to give the baby. Milk at the end of a feeding will also be higher in fat. You can show her ways to feed that express milk to the baby. If the milk she expresses is more than what the baby will take, one option is to allow the fatty part of the expressed milk to rise to the top of the collection container after refrigeration. This fattier milk can be spooned off and given to the baby in a spoon, a dropper, or a syringe. Mom can store the remaining milk for later use. If the baby's provider recommends larger supplements, one option is to feed it to the baby at the breast through a nursing supplementer if that's desired by the mom. You can help the mother gradually wean from the supplements once the baby's weight stabilizes and mom's milk production is sufficient. Mom can monitor dirty diapers to look for increased quantity and changes in color to more yellow. Refer a baby who is underweight or shows signs of dehydration to the baby's healthcare provider immediately. DBEs work with the CPA to develop a care plan to address mom's breastfeeding concerns and to tailor the food package based on the supplementation needs of the baby. You can also, of course, connect the mother to a peer counselor for ongoing support while you help her with the complex issues that she's facing. This ends the Level 4 video, Underweight Issues in the Complex Infant Problems video series. Please take a few moments to pull out your WIC Action Journal and turn to the Complex Infant Problems page. Write down something you did not know before viewing this video or something you want to be sure and remember. Set at least one goal of something you will do with what you have learned. Please complete the Level 4 post-test for this video. Please turn it into your supervisor along with any handouts for this video series.